mechanisms. However, it is best that we have ideal parallelisms, and therefore planning and proper surgical execution has to be done. There are certain tips to follow that, how to use paralleling pins, the drills, do sequential drilling, and that will be discussed in the next sessions. What is important is that what planning we did clinically, what we did radiographically also is translated to the surgical site, and therefore the same duplicated denture can be used as a surgical stent, albeit with a little modification. Now we have to make it suit to the surgical site, therefore we have to trim the labial and the lingual flanges so that it does not interfere with the reflected mucoperiosteal flap during the surgery. And based on the planning which we have done, we have to mark the selected site. Right, generally suppose it is for this patient, it is lingual to the canine, so we know where our initial osteotomy punch cut will lie, and therefore we can have a proper placement of the implant. Secondly, these stents have to be disinfected prior to surgery. Now with this I am concluding this session of planning for the implant and tissue supported overdenture in the mandible, with implants placed in the B and D sector, with an overview of the different overdenture designs and the prosthesis mobilities which are possible. And now when you go to your second clinical sessions, wherein the counselors will discuss these things in detail and demonstrate on patients also, a workup for a patient, you will understand it much better. Any questions, you please feel free to ask right now.
Okay, thank you, Dr. Abhinav, for the presentation, and I think it has been really well understood and imbibed, since we didn't have any questions, so I feel that they have really understood it very well. So anyway, I think it will be there to see when they have the examinations. So I really thank all of you for having come for the teleconferencing and attended the same, and I also thank Dr. Abhinav for having spared his time and explained everything so I think in so much of detail and so meticulously, which I think should really, if you have heard him properly and you have followed him, then I think it will be really helpful to you in your second contact session, and it will go a long way. So thank you, Dr. Abhinav, for the presentation.